Good day and welcome to today's conference call with the Association of State and Territorial Health Officials. Today we are going to discuss tips for safe in-person voting. As a reminder, ladies and gentlemen, today's conference is being recorded. At this time, I would like to turn the conference over to Mike Fraser. Please go ahead, sir.
Thanks so much, and good afternoon, everybody. I'm really sorry we're starting a little bit late. I know how valuable your time is and how busy you all are, and I apologize for that, but we'll get right into it. Thanks for joining us today for our media call with the Association of State and Territorial Health Officials, or ASTHO. I'm Mike Fraser. I'm the Chief Executive Officer here, and I'm really, really excited to share with you the expertise of several of our national public health leaders and partners across the country. We've got Dr. Rachel Levine on the line. We've got Dr. Umair Shah on the line, as well as Jessica Barba Brown, who's going to share some information from her organization, We Can Vote. So much more to come, and I hope you all stick with us for the entirety. We're going to keep our expert remarks to brief overviews and then allow ample opportunity for you to ask questions and follow up. This call is on the record and open to press and partners, and again, we're just thrilled to have all of you joining us today. We wanted to highlight, as we approach November 3rd, the fact that public health has been working tirelessly with partners in agencies across the country, secretaries of state, election directors, to assure them and provide expertise that it's safe to vote, both in person and also to share options regarding mail-in voting and absentee ballots. We think that the message around safe voting is particularly important, especially in light of some new research around COVID transmission, as well as increasing cases of COVID transmission in pretty much every state across the country. So this is a really timely call, and we want every American to feel safe and assured that their vote can be done safely and can prevent COVID transmission in the process. And our public health leaders are committed to this goal. They're working, again, as I mentioned, with local election officials, state election officials, and I know our local partners in local health departments, city and county health departments, and territorial health departments are similarly engaged. It's not unusual, but it's certainly rare that we have public health officials engaged at this level of effort with the election process. But again, it's a sign of the times for sure. So I do want to refer you to our Vote Safe Public Health website on the ASTHO.org website, where you can see lots of information, but also, and I think most relevant to this call today, a letter that our Vote Safe Public Health Coalition issued to all Americans. This came out on the 15th, and it was signed by 10 different groups, many representatives of which are actually listening into our call today. And if you want to list of those 10, it's on the letter itself, but I'll just briefly go through this and then turn it over to our experts. We were joined by the American College of Preventive Medicine, the American Public Health Association, the Association of Schools and Programs of Public Health, the Big Cities Health Coalition, the National Association of County and City Health Officials, the National Network of Public Health Institutes, the Network for Public Health Law, the Public Health Accreditation Board, and the Trust for America's Health as partners in our Vote Safe Coalition to share information on how to vote safely in the midst of a global pandemic, and to assure that officials making decisions about safe voting were well informed with current guidance, and the public was well informed by current guidance written from the public health perspective. Also on our website is a link to the 10 to 15 things you can do to vote safely in person. And we know lots of folks will be voting in person, despite lots of coverage of how early voting is going in many places as well. So as I mentioned, we're joined by 3 experts, and I'm going to yield the rest of the time to them and then to you all to ask questions of them. But just to remind you, we've got Dr. Rachel Levine, and that's spelled Levine, MD. Rachel Levine, MD, who's our Secretary of Health in Pennsylvania, with the Pennsylvania Department of Health, and also our ASTHO president. We're also joined by a friend and colleague, Dr. Umair Shah, MD, MPH. Umair spelled Umair, Shah, Shah. Dr. Umair Shah, who's the Executive Director and Local Health Authority Director for the Harris County Public Health Agency in Houston, Texas. And then we're joined by Jessica Barba Brown, Jessica Barba, B-A-R-B-A, Brown, B-R-O-W-N, who's a senior advisor with an organization called We Can Vote. And we're really excited about this partnership with We Can Vote that works in all the states to share information about healthy voting, as well as options that folks have for both in-person as well as other options for mail-in and absentee ballots. So I'm going to turn it over now to Dr. Rachel Levine to discuss Pennsylvania's approach as well as some national perspective as president of the Association of State and Territorial Health Officials. Thanks, Rachel.
Well, good afternoon, and thank you, Mike, for that introduction. I'm so pleased to be here today as part of this very important discussion. Voting is clearly an essential part of our democracy. And this year, voting by mail and voting in advance are the safest and easiest ways to vote, if at all possible, based upon individuals' state laws. In fact, Saturday is National Early Voting Day, a day where we encourage people to cast their ballot and to mail it in. However, voting in person is each and every one of our rights, and we want to ensure that we can all do that safely, and access and safety are actually key. Health really has such an important role in social justice, such as voting and civic engagement. In fact, health has an important role in many policy decisions, and actually we like to say in public health that we want to see health in all policies. This has to do with the social determinants of health, those aspects of social policy that are not typically associated with health. From that perspective, economic opportunity and a living wage are health issues. Transportation is a health issue. Housing is a health issue. The environment, nutrition, and voting are actually all health issues. One thing that is important to note is that communities that actually have higher rates of voting have better health outcomes. The results of this election will impact the ongoing response, of course, to the COVID-19 pandemic. It will impact healthcare availability for individuals, particularly those with pre-existing conditions, and many other health policy impacts. In Pennsylvania, we are strongly encouraging people to vote early by mail. However, our polling places will be ready for those individuals that are ready to vote on November 3rd. Polling places are taking all precautions to protect individuals, and of course, the staff at the polling places will have necessary personal protective equipment. But we do recommend that if you're going to go vote in person on November 3rd, to have what we call a COVID kit if they're going to vote. In that COVID kit, they should have a mask, hand sanitizer, antibacterial wipes, a blue or black pen to mark your ballot if that might be necessary. And in Pennsylvania, your cell phone, because we have a great app to help us in terms of contact tracing, and that is called the COVID Alert PA app. Other contiguous states such as Delaware, New Jersey, and New York are using very similar apps, and that's very important in terms of contact tracing. Of course, while at a polling place, which is a public event, it's important to follow all of the precautions that we emphasize every single day. It is our collective responsibility to wear masks, to wash your hands frequently, including after voting. Use hand sanitizer if it's not easy to wash your hands, and maintain social distancing, especially if you're voting and you have to stand in line. Please stay 6 feet away. With that, I'll turn things back to Mike.
Thanks so much, Dr. Levine. I love the COVID kit, and I wonder if other states are doing that. I haven't heard that yet, so I'll highlight that as one great idea for other states to emulate. But I'm sure Dr. Shah has similar innovation. He's, as I mentioned, the Local Health Authority Director in Harris County, Houston, Texas, and a good friend of public health and good friend of mine. So, Umair, thanks so much. We know you're really busy down there and would love to get your take what's happening locally and nationally with your colleagues that are county, city, and big city health officials.
Well, thank you, Mike, and thank you for hosting this very important call and this discussion. And I just want to echo what Dr. Levine just mentioned and the incredible partnership across the system with our federal, state, and local public health officials really working hand in hand, especially in a very difficult time as we have with this pandemic. We recognize, as Dr. Levine said, that voting is a public health issue, and the balance right now is really health and safety of individuals who are exercising their right to vote with the ability to, the civic duty and the ability to exercise that right to vote. And the way I would look at it is that it's the way we've said it in public health is that it's not an either or, it's an and, that we can vote and we can actually do it safely and with health and medical in mind, which I think is an incredibly important way of looking at things across the community that all of us are very much a part of, and certainly doing our best to make sure that voters are safe, but also making sure that poll workers and those affiliated with the voting process are also safe and sound as well. Texas is, as you all know, the second largest state in the country with close to 30 million people. Harris County is the largest county in Texas with close to 5 million people. And I will say that one of the biggest challenges that we have is really how do you have voting done in a safe way that really allows for individuals to do what Dr. Levine mentioned, which is to exercise that right to vote safely. Governor Abbott did do something that we thought in July was appropriate and very helpful, which was to extend early voting by an additional week. And what that has allowed for various jurisdictions across the state is to actually not have voting compressed in a shorter time frame, early voting, and it also allows for decompression across more early voting days, which then hopefully also means that people will be early voting and not spending as much time on the day of the election, which then, as we all know, can increase the compression of people in one day, which obviously is an increase in risk for COVID-19. In addition, Texas allows for mail-in voting, mail-in ballots, and the deadline actually for that is tomorrow, October 23rd, and that allows, again, for people, especially those who are above the age of 65 or disabled or otherwise not able to come to voting locations in person, to be able to protect themselves, but also to exercise the right to vote. And those ballots, depending on whether they're postmarked or not postmarked, will need to be received by November 3rd or 4th. And finally, actually two final points. One is around drop-off voting. I'm certain that the audience has heard of what's happened in Texas, where the governor did on October 1st make the announcement that per county you would have one drop-off location, which certainly has been a real issue, at least for us locally, in that you have a county that may have just a scant number of maybe a few thousand people, but in a Harris County where you have, as I said, just shy of 5 million people that spread over the size of Rhode Island, you still only have one drop-off location, which also then gives the concern for people having to drive over, with the 1,778 square miles, you can sometimes take an hour to get to that one drop-off location. You add in traffic in Houston, and now you're looking at maybe a 2 or 3 hour exercise while you're also having to make sure you get there during the hours that things are available. The second point is around mega centers, that there have been mega centers that have been open throughout the state with local elected official, local county voting officials, which includes the large facilities such as the Toyota Center where the Houston Rockets NBA basketball team play, as well as where in Dallas the Dallas Mavericks play. And that allows, again, for ample allowance of space and distance, so you can of course, allow people to be able to come in and not be crowded upon each other. I will point out in Texas that mask wearing is not required. That was made clear by the state, although it is strongly encouraged. And certainly that is something that, from a public health standpoint, does concern us. But at the end of the day, with the increased number of days for early voting, mail-in ballots, and then drop-off locations that that really is one throughout the county, but also mega centers. We're hopeful that people will remember they can vote. They just have to keep in mind voting safely. And so with that, Mike, I'll turn it back to you. I certainly have additional comments, but I want to make sure that I'm respectful of time of others.
Thanks so much, Umair. It's great to hear from you and what's going on down there. And thanks for putting that in the local context about what the state is doing around mask mandates and actually not mandates and what that might mean. So we appreciate that. I'm going to now invite Jessica Barba Brown, who's a senior advisor for We Can Vote, and have her share what the work of their organization has been, and also have her share what she's hearing from colleagues across different sectors, not just health, as she's done the really important work of sharing information on every state and their voting policies. So, Jessica, welcome, and thanks so much for being with us.
Thank you so much for having me, Mike, and thanks for putting together this really great call. As Mike said, I'm Jessica Barba Brown, Senior Advisor for We Can Vote. We're a nonpartisan coalition that has come together around the shared goal of ensuring that our elections are safe, secure, and successful in the face of the COVID-19 pandemic. We Can Vote is supported by elected officials from both parties, by major U.S. companies, by prominent civic engagement organizations, and by leading public health associations, including ASTHO. And when we were putting together this coalition back in March, as the pandemic was unfolding, I reached out to these public health organizations quite out of the blue and said, hey, can you join us in this mission? And they didn't hesitate for a moment to get involved. So even as they have been dealing with contact tracing and school reopenings and so many other issues that have been so important during this time, they have also really put our democracy front and center and are keeping Americans safe as we cast our ballots this year. So I really want to thank all of the public health officials for their incredible work this year. And we know that this election is going to be a challenge, but it's the kind of challenge that we've met before. Public health officials and election administrators are working together across the country to ensure voting is secure and that we can have a successful election, just as we've always done through 2 world wars and the 1918 pandemic. And the good news is that this year, Americans have options to vote safely and securely in a way that protects ourselves and the health of our communities. Elections administrators have had months to prepare since the primaries, and so we're seeing a lot more robust mail ballot experiences and more resources like bigger polling locations and PPE and a new generation of poll workers. And Dr. Shah spoke about how this is playing out in his county. And the great news is that Americans are really taking advantage of these options. My favorite thing every day is to refresh the U.S. Elections Project website, which tells me how many Americans have already cast their ballot this year. And over 45 million Americans have already voted. And this is great for democracy, but it's also very good for public health as we reduce lines and crowding on Election Day, which is what we've been working so hard to do. And to help voters navigate their options, we, along with the American Public Health Association, the National Association for County and City Health Officials, and elections administration experts have created state-specific healthy voting guides, which are available at healthyvoting.org. And this is the first time that public health experts have issued voter guidelines. And These guides draw from best practices in public health and civic design to help voters participate safely in our elections, whether they're voting by mail, early voting, or casting a ballot on Election Day. And we're thrilled that across the country right now, these guides are being distributed by local departments of health and health clinics, at food pantries and flu shot sites, as local public health officials educate their communities about their options for voting this year. And it's so important this year that voters have trusted sources of information, and that's why we're encouraging all voters to defer to their local election administrators and listen to their local public health leaders. Election administrators and health professionals are frontline workers, and democracy is an essential service. These next few days, we all need to do our part to vote healthy, to protect ourselves and our community. This has been a very hard year, and it's one where so much feels out of our control. But when it comes to how we vote, we have a lot of healthy options. So with that, I will turn it back to you, Mike, and look forward to taking some questions.
Thanks so much, Jessica. We appreciate that. One of my favorite things to do is to look at those counts too, so we can both revel in that as the days go on. I'm now going to turn it over to you all, our media partners who joined us for this call. And operator, would you mind reminding folks how to queue up for the question?
Thank you. Ladies and gentlemen, if you wish to ask a question at this time, please signal by pressing star 1 on your telephone keypad. Please make sure your mute function is switched off to allow your signal to reach our equipment. And the voice prompt on the phone line will indicate when your line is open. And that's again star 1 to ask a question. Please state your name and your news outlet before posing your question.
Thanks so much. We'll let people queue up now. We have until we have a few more minutes, and we can go a little bit over if our speakers are available. If not, they can just let us know they need to disconnect, but we want to make sure you have time to queue up. Remember the public health messages here, wear a mask, don't touch your face, speed the process by being prepared for your state requirements if you have to show IDs. Try to vote during off-peak times if you vote in person. If you are ill, definitely contact election officials about the options you have. That's something that happens in routine times, especially and now. Wash your hands before and after voting. Try not to disinfect the equipment yourself. Let the poll workers do that. Look for single-use voting supplies. Maintain your physical distance and observe all signs in posting places. I'd be remiss if I didn't share those public health messages. So thank you all. And we do actually have till 1 o'clock. I apologize. I thought we were going to try and abbreviate this, but let's go through till 1 for folks that are able to stay on the line and make sure we answer all the questions that come up as best we can. Thanks, operator. Why don't we go to any first question?
At the moment, we have no phone questions, but as a reminder, ladies and gentlemen, that's star 1 on your telephone keypad to ask a question.
Great. We'll let that go for 1 more minute. Panelists, anything you wanted to add before we potentially transition over to Q&A?
Mike, can you hear me?
Yep.
Yeah, Mike, Umair, I just wanted to make one comment. We have here in Harris County and actually throughout Texas, we are seeing a remarkable increase in early voting. And in fact, the early voting here in Harris County in particular has shattered the previous elections, the most recent election in 2018 in terms of early voting. And so, it does bring up another point, which is also we have to remember that our communities are also heeding messages that they're seeing or hearing from both elected officials and also public health officials. And the message that we've been giving to our communities, and I know my colleagues will share the same sentiment, is that, if you can early vote, if you can, mail-in vote, if you can curbside vote, if you can do whatever you can earlier than later, meaning not on the day of election, that would be better because, again, in the midst of a pandemic, we want to decompress the number of people that are going to actually be coming on the day of election into polling locations. Not to say that polling locations on the day of election are not going to be safe to vote, but just to decompress gives us the best opportunity to fight this virus. Our local Harris County voting official the county clerk, has been really doing a fantastic job. We reviewed with his office their plans and gave some suggestions, and there has been a really incredibly strong collaboration with our county elected official, Judge Lina Hidalgo, and county elected officials in general. And really our goal is to make sure that people exercise their right to vote, but just to make sure they do it safely.
Great. Thanks, Dr. Shah. Operator, any questions in the queue?
There are no phone questions at this time.
Okay, great. Well, we know folks are busy and there's lots of stories, and also that we do have some time before the election, and people are probably queuing up stories for that. But what we will do is make this call available in archive as transcript and also recording and send it out to our media contacts, so as a resource for stories that may be developed in the future. With that, I do want to remind you that we're always available for follow-up, and we can make our experts available for follow-up and connect you with other state health officials if you're interested in a local angle. You can contact us here at ASTHO. Definitely email media@astho.org or contact our Director for Public Relations, Jane Asworthy. I think you have her email as she sent the media advisory out to you about our desk side briefing today. So it's 12:30. I want to thank everybody for their time and thank our speakers, Drs. Levine and Shah and Jessica Barba Brown. Thank you so much for being with us. Please visit the We Can Vote website. Please visit the ASTHO website and the websites of our coalition partners, our Vote Safe Public Health Coalition partners. And if there is any clarification or follow-up you all need, we stand by. With that, I'm going to ask folks to have a great rest of the day and disconnect.